What is your fondest memory from your childhood? Playing in a park, looking up at the blue sky, cuddling up with your mother, feeling cared for, comforted, free. That's not the reality for Remy, a 4-year-old patient of mine. She was born with normal eyesight, but her vision started deteriorating a year ago. And as of today, she is completely blind. Today, she is a picture of frustration. She keeps cursing her mother, hitting her. She scratches herself out of sheer agony. Her world has been plunged into darkness. This is the reality for 500,000 children of this world every single year. 500,000. That could easily be the population of a small city. Imagine a city full of blind children. I am a doctor here in India, and I'm here to tell you why this happens. It's 2023, and yet every single year, thousands of children become blind for a reason that you and I could have easily prevented, for deficiency of an essential vitamin in their diet, vitamin A. Every third child in the world under the age group of 5 years suffers this deficiency. These are children who live in the extremes of poverty. They have never seen eggs or fruit or butter, and their parents, they don't have the luxury of missing a day's wages to get them vaccines or supplements. They are severely malnourished. All bones, no fat. Their skin hangs loose in folds. Their sparse hair thins and falls out in bunches. Their eyes are sunken and faces gaunt. The vitamin A deficiency ruins their immune system. It makes them prone to severe infection. It progressively worsens their vision, starting out from reduced visual acuity and going on to a full-blown corneal meltdown and irreversible, complete blindness. And that's not even the worst part. Half of these children who become blind die within a year. My tryst with vitamin A supplementation began when I was a resident doctor. Every day we would see children die or become blind. Parents would visit the OPDs, completely distraught, unable to comprehend why their child couldn't see any longer. They had, after all, done their best. Many were so in denial that they sought to witch doctors, herbs, potions, prayer, and several others resigned to the sheer helplessness of the situation, labeled it God's will. Their guilt was palpable. But they didn't fail as parents. We as a society have failed. The government runs several programs to combat malnutrition. Vitamin A has been included in the National Immunization Schedule as well. And one of its best sources, breast milk, is universally available and completely free of cost. So why are we still failing to save these children? It is because these are children who live in far-flung areas, isolated by harsh terrain, bad climate. There are children in tribes, socio-culturally away from the rest of the world. There are parents who opt out of vaccinations. There are families where the good food is given to the male child and the girls are left to starve. And there are mothers who are so severely malnourished themselves that they produce inadequate breast milk of poor quality. I saw all of this on a daily basis. It was like living in a nightmare. And then one day we lost Pavitra, another 4-year-old. She was barely 10 kilos and had dried out corneas. I had to break the news to her parents. They kept asking me, why did this happen? Why did she die? It was only an infection. Surely those were curable. I had no answer, only stunned, deafening silence. And that was when I decided to do something about it. So in 2017, I founded Every Infant Matters with a view to fight this terrible injustice. The modus operandi is simple. We hire and train local people from within communities to work as health providers. They then go door to door to give vitamin A to all under fives. And let me tell you, this is not expensive at all. In fact, it costs less than a cup of roadside chai. They deworm children, making sure that intestinal worms do not absorb up the nutrients from a child's body. They provide holistic health education, focusing on promoting breastfeeding, immunization, and dispelling the harmful myths prevalent in societies. The second approach is that of working via partnerships, and our largest partnership is that with the Government of India, where we train the government's ASHA workers to implement the solution. We also partner up with a number of non-governmental entities who work at a grassroots level. With these few steps in the right direction, we have been able to save more than 280,000 children from going blind by giving them vitamin A. We have reached 15 states of the country, going as far up north as Kargil, going as far east as the Indo-Myanmar border. We have covered the valleys of Kashmir, the mountains of Uttarakhand, and the deserts of Rajasthan. In 2019, we were able to cross international borders and reach Nigeria. And in 2020, despite an ongoing global pandemic, we were able to replicate the model in the Philippines. But the need is worldwide. The cost of giving a child vitamin A is rupees 20. But the cost of not giving a child vitamin A is astronomical, one that is borne by families, economies, and entire countries. Persistent gaps in vitamin A coverage must be addressed on a warlike footing, or else children will continue to suffer and die, and their devastated mothers will continue to weep over them unless we embrace this battle. If not, we shall continue to lose these innocent lives, and mothers will mourn loud and long. Thank you.